Hi there. The United States is experiencing an accelerated rate of mortality due to cardiovascular disease. Um, we often think of February as the month of love, but it's also Heart Awareness Month. And given these newest findings, we wanted to bring to you some valuable information from our partners at UTMB Health. They're our preferred providers for the League City, Bay Area, Galveston, all of my people to the Southeast. Hi, my name is Megan Clanahan. I am the co-owner of Houston Moms. Today, I am so excited to have with us Dr. El Haddad, who is leading the charge for cardiovascular and mortality outcomes at UTMB Health. Dr. Al Haddad, thank you so much for joining us this morning.
Thank you.
Can you tell us a little bit about yourself, your background, and where you practice, all that good stuff?
Sure. So my name is Danielle Haddad. I actually I did my internal medicine residency at UT Austin at Dell, and finished and came to complete my fellowship here at UTMB, cardiology fellowship, cardiovascular medicine. And um, and as soon as I graduated, I got interested in a subspecialty that is probably emerging, really not very, not, it's kind of a little bit newer to the other subspecialties in cardiology, which is called Obstetrics. And this program is getting more and more, um, I'm trying to find a word. Attention. Yes. It's getting more attention around the world. I mean, technically, not only in the United States, but all over the world. But it's kind of more important for the United States to start implementing these programs all around the states. Unfortunately, we still don't have much in Texas. And the reason why it's important is because the maternal mortality has been increasing all over the world, but most importantly in the United States. It has been rising since 2018 to 2020. It hasn't been, these are the last numbers we have. It hasn't slowed down, and it's at least 10 times more than the other developed countries, which is very surprising given the advances in medicine that we have. Now, the problem also in Texas is that the ratio is very high, higher than other states. We're not sure why, but it seems like Black female have a more higher risk of having not cardiovascular disease in general, but maternal mortality in general. Now, maternal mortality ratio is high, and that is because of two major things, and they are kind of about the same percentage. It's mainly postpartum hemorrhage, but also cardiovascular disease. So it's still the number one killer. And as a mom of three, you can tell that this is very tragic to me to imagine, God forbid, dying and leaving all my family behind. And you can imagine the misery that a family, a spouse, a mom, a sister, or even a child that is left without a mom just right after delivery. Unfortunately, it is the postpartum period that is the most critical for these women. And patients tend to just say, hey, I delivered, I'm fine, just disappear. But we are trying to raise awareness. This cardio OB program is important. It's a multidisciplinary program, so it involves a lot of other subspecialties, especially maternal fetal medicine, which is kind of the OB that take care of high-risk pregnancies, along with the cardiologists, but also subspecialists in cardiology field, or even cardiothoracic surgeons and mental health specialists, which is very important, as well as a lot of other nursing staff.
Yes. That is a lot of great information. And I think some of the stats that I read are kind of mind-blowing, with approximately 18 White or Hispanic women are dying for every 100,000 live births.
Yes.
55 Black women dying for every 100,000 live births. And I mean, there's certain things we can attribute cardiovascular disease to, but who are people who are high risk for these types of, you know, potential deaths, if you will? And what do they need to know when they go into appointments with their OBGYN?
Okay. So first thing, most important is patients that which patient had a prior high risk complicated pregnancy is at risk of having another one.
Mm.
That's all well known. Now, if it's your first pregnancy and lots of unknown technically, or maybe doesn't know her family history because mom's also history is important, um, then you start looking for risk factors. Uh, Nowadays, it's been like something very common, I bet, especially in the north, up north, is that women tend to get pregnant at an older age, right? And they finish education and everything, and they start the family a little bit older than before other generations. So they tend to have maybe a little bit more risk given the age, but also they come with more comorbidities. Some of them have more higher blood pressure, have more cholesterol. So a lot of risk factors that you would not quite see at a 20-year-old, maybe see at a 30 plus, 35 plus years old, um, may contribute to that risk. So technically, high blood pressure, cholesterol, obesity, unfortunately, is a risk factor itself for gestational diabetes, which is that gestational diabetes is a high risk for complication for the baby, for the fetus, as well as for the mom. Um, any history or possible preeclampsia, which is hypertension with more complication, and just unfortunately being African American, African descent. That's what we're saying is a risk factor. And as you can see, it's not necessarily a lack of resources because of the Hispanic is way lower than the Black American ratio. So they think that it might be just African descent, like ancestry, is maybe has a role in this risk.
Okay.
Um,
And since we're
yes,
talking specifically, like, cardio and cardiology and our heart,
yes,
I mean, I think a lot of us are walking around thinking, mostly it's fine. Like I'm still breathing.
yes.
I'm doing okay. What about that mom who's like, do I have a cardio risk? And how do y'all evaluate that in office? I mean, I know obviously it would be signaled by blood pressure or whatever. Are there any other tests that we need to know of, or what should we be prepared to look out for? Um, because you said this specifically kind of happens like after you've delivered and you think everything is all good. What should we be looking for?
So there are a lot of things that can happen during pregnancy. I'm not just disregarding these cases, but so it's important to know that any pregnant woman, as you know, is under a lot of stress. So it's a stress test. So your cardiac output will increase just like a stress test, being on a treadmill. Can you imagine that on a 10-month period? So, and oh, even more maybe. So I'm just saying that these patients, every single patient feels different. I felt different, you probably did. But some patients can tolerate it as us. Some patients start having symptoms, weird symptoms that should be kind of alarming to them. Technically, if they have a lot of palpitations and their heart rate is always sustained in the 125, these are signs of abnormal response. A blood pressure that is always checked at the OB, this is okay, and they check the urine also every time you go to the OB. So that is kind of a little bit more controlled. Now, also blood pressure, if you're starting having headaches, visual changes at home, and you start noticing a higher blood pressure than usual, also these are kind of signs concerning chest pain, abnormal left lower edema, swelling. So you started swelling. Now, patients, don't get me wrong, patient will get some swelling. But if it's very abnormal and patient cannot even sleep on their left side, they have to sleep upright. So that kind of sounds a little bit alarming to me. And I think patients should never ignore some of these signs. Sometimes they attribute it to normal physiologic changes of pregnancy, but indeed it's not. The patient know that something's wrong. And I've had patients coming in tell me, I've been having this heart rate of 120 all the time. So that at that point we order tests. I don't think we need to order ahead of time, or OB or family docs should order that before ahead of time. But I think they should start noticing different physical exam like a murmur or the patient's complaints and send them the right way at the right time.
So that's really that's kind of the first step of moms starting to advocate for themselves and being like, look,
Correct.
I
Correct.
do not feel well here, and I don't think this is how it's supposed to roll. I think a lot of times we suffer from martyrdom, mom martyrdom. Supposed to be this is supposed to be hard. We're bringing babies into the world. In my case, I was bringing two at one time. Um, so I knew it was not going to be like, a super fun, like it really wasn't fun for me. Like I didn't have a good time with it. But
So twin pregnancies is a higher risk for cardiovascular disease itself because you're having two fetuses. So it's by itself, it's a higher risk pregnancy.
great point. I mean, because we have a lot of twin and
Oh,
triplet pregnancies these days, and
yes,
I will tell you, it drained everything that I had from
I
myself.
bet.
I mean, but what I didn't think about was kind of the after, because the after, I'm just like, I'm trying now to keep one, two, three babies alive, and
For five,
however many
yeah,
kids you have at home, and you're just, again, it's that like mom martyrdom where you're kind of going to like, I'm fine, I'm fine. I I have to worry about the baby. Like, are they eating enough? Are we sleep? And so what would you say to the mom who, is maybe middle of the night being like, you know what though? I don't feel right. Because that's when problems can happen too, right? So what would you tell them?
exactly. Get yourself checked even before the appointment that is scheduled always at around 6 weeks postpartum. Get yourself checked before. If you start feeling weird and odd, just go to get yourself. And if it's really chest pain, acute chest pain, call a 911. If it's acute chest pain and pressure, because you're at the first week postpartum, you're at the highest risk of having what we call SCAD, which is a dissection of the coronary artery. And unfortunately, we still don't know why some women tend to have that. It can be just a normal young woman, but it's probably the stress and the hormonal changes that is involved in it. And also sometimes even breastfeeding. I'm not saying that I'm against it. Of course not. I highly recommend breastfeeding. But there are some theories that they say a lot of causes can lead to this complication, unfortunate complication. So never ignore chest pain, very fast racing, sustained fluttering in the chest. All of these are concerning. Shortness of breath, that is very unusual because after you deliver, you should probably be okay. If you start feeling like you can't climb stairs normally, all of that are very concerning. Um, even depression and anxiety, we should talk about it more. I
Mm.
think that if we're anxious and depressed, we will not notice these signs too. I think I'm one of I had anxiety, postpartum anxiety, very bad. I had to be treated. So I think I'm very open talking about it because women tend to be alone in this time. It's unfortunate, but it is. Um, it's the loneliest time, I feel. Even though you have a baby, you're so happy to have a baby, but sometimes you feel alone in the middle of the night, and it's very traumatic to me. I had PTSD from all three pregnancies, so it's a very difficult time postpartum, and we should talk and speak up when you feel something is abnormal.
I mean, I could not have said it better because it truly is lonely because you know, we carried it. A lot of times we're
Yes,
doing the hard labor of,
exactly,
the breastfeeding and at midnight, it's just you and this beautiful creature you brought into the world, but then your anxiety also increases. And thank you for bringing up
exactly,
anxiety because I know, like for me, same anxiety, um, it mimicked heart issues because my heart
exactly.
would race and my throat would feel thick. And um, yes, get that treated too. So all of this kind of sounds like, whew, okay, it's a little scary. Like if I have like a mama who's pregnant out there and watching and whatnot. Can you speak a little bit to the program that y'all are doing and how you are hoping to kind of bridge this gap between obstetrics and cardiology so that these maternal mortality rates can improve because these numbers are kind of horrifying.
So there, it's still rare. Okay, let's just be honest. But it's still rare. But even one single death is tragic, right? And we try to avoid it since these patients don't know they have any disease and they should not have any disease. Now, um, we are being in contact more nowadays with the OB, and it's very nice. I've built this good relationship with some of them in our program, and I'm building with others. And like I read one echo that was ordered by an OB that had a patient, it said, patient has a murmur and she's pregnant. I read it, it turns out that she has what we call pulmonic stenosis. But pulmonic stenosis is very well tolerated during pregnancy, no matter how severe it is. So the OB texted me and said, do you need to see her? Do we need to intervene? She's end of pregnancy and she's doing well. And then there was like a very good discussion between both of us so that we don't alarm the patient also. We don't want to alarm her if it's not needed. We said,
Mhm.
no, just let her know that it's well tolerated. We can help her after that. But this patient should be seen by cardiology right after pregnancy and delivery because she needs to have that pulmonic cirrhosis treated and followed, surveilled, I guess. So there's a lot of things that can be reassuring to the patient, but it's good to know. It's good to know that she has something. And
Mhm.
I think this is the most important thing is alarm the patient when it needs to be really, and kind of be reassuring when it needs to be. So I don't like to be also scaring everybody, but I just want them to listen to their body and know when there's something wrong to go and speak up.
I think that's perfect advice. And this is what I love about UTMB Health is that you guys have the best comprehensive care. So your OB can be in touch with you. You can chat back and forth to make sure that that patient has a good outcome. And that if there needs to be a referral, that will happen. It's that big so they're not just living in an OB vacuum to have to
Exactly.
find on their own a cardiologist or whatever they need. Quite frankly, I have a daughter who has a heart defect, and so um, you know, we always wonder what pregnancy is going to look like if that's her choice later on in life. And so it's good to know that these programs are developing and continuing to move. And so last question for you, because I know we've covered a lot of information, but
I just I
yeah.
just maybe missed something. So this program, this is the most important thing actually, and it's we're working on it with OB. They're getting a little bit surprised right now, but we're trying also the most important they're calling for the OB as well as the cardiologist in the United States. They're calling for pre-pregnancy planning. So they want us to have such as your daughter, I'm not sure what she has, I'm not going to speak about it, but if they have a known congenital disease or if they have a known acquired heart disease, we like to pick these patients and have them seen before they get pregnant, plan the pregnancy, and actually recommend advice against pregnancy if these patients are known to have a risk of eventful pregnancy up to 100%, which is pulmonary hypertension or heart failure. So these patients tend to be like, we have to talk to them about contraception during their pre-pregnancy planning and kind of advice against pregnancy. So it's nice to see these patients pre-pregnancy, have them see the classification, where they stand, and explain to them how pregnancy will affect them. And also, even patients with hyperlipidemia, familial hyperlipidemia is not uncommon. And these patients by itself are a higher risk, right? They can have acute MI. So these patients should be evaluated before, and also talk about their how the patient's possible offspring will inherit these diseases, right? So we also have to involve the geneticists. So there's a lot of things that are really nice that can happen pre-pregnancy, and I've seen some so far. It's still a bit surprising for some OB, but why are you coming to see me if you're not pregnant? But hey, this is what we're trying to do. This is our movement right now, to have a pre-pregnancy planning so that we avoid complication during a pregnancy, unwanted, unplanned, or planned, but without knowing the consequences.
I mean, I was going right there and
Oh,
you got
I'm
it.
sorry.
No, no,
Sorry. I
no,
just wanted
no
to talk
sorry at
about that.
all, because I was just about to ask what we should think about before we get pregnant.
Yes.
You know, hopefully I mean, for us, it was a plan and it had to be laid out. And I think that's great tip. So if you know that you have any sort of cardiovascular issues or what have
Okay.
you need to be talking to your PCP, talking to your
Yeah.
OB, letting them know so that they can help give you the best possible advice and outcome should you become pregnant. So um, excellent there. You got it. Nailed it. So much helpful and great information you've shared with us today. I'm incredibly thankful. I know our community of moms is incredibly thankful. Um, there's a great article that UTMB Health has out there that we're going to drop into the comments below, and it's talking about this merge between cardiology and obstetrics, and how you guys are working together to help reduce those maternal mortality rates, so we can help get those down. And we hope that this video has been helpful for you if you're pregnant, planning to become pregnant, or perhaps you know somebody who's pregnant. This would be a great video to share with them. We're also going to drop comments below about where you can find an OBGYN within UTMB Health. If you are having signs of cardiac where you're not feeling yourself, we're gonna put cardiology in the links below, but you need to be calling your OBGYN or your primary care physician. We'll also put links below where you can find one of those two within the UTMB health system, our preferred providers for the Bay Area, Galveston, League City, Pearland, all of you people down in the Southeast. Dr. Al-Haddad, thank you so much for joining us today.
Thank you for having me. Thank you.
It was a joy. We will be back next month with another important health topic. If there's anything you guys want us to cover too, let us know. We would love to be able to bring on an expert to chat about that as well. Until next time, enjoy the month of love, Houston, but also be cognizant of those cardiology and heart month awareness things. Take care. Bye-bye.